An Introduction to Addison's Disease in Dogs, narrated by me, Sydney. Addison's disease is a disease where the dog's adrenal glands do not create hormones, specifically aldosterone and cortisol. Aldosterone is a steroid that balances sodium and potassium in the bloodstream and affects the kidneys. Cortisol is a steroid that increases sugars in the bloodstream and affects functions during the flight or fight response. Both steroids play a big factor in the dog's bodily functions, so without them, their bodies begin to have serious complications. So what causes Addison's disease? It is not known what exactly causes the disease. Most cases indicate a destruction of the adrenal glands. Primary Addison's is the dog's body destroying the adrenal glands. Primary Addison's can be furtherly categorized as typical and atypical, with atypical meaning the dog's body still produces aldosterone but not cortisol. Secondary Addison's is a result of other diseases, such as tumors or short-term steroid use. Addison's can be found in all dog breeds, but some breeds are predisposed, such as Standard Poodles, West Highland White Terriers, Great Danes, Bearded Collies, Portuguese Water Dogs, Nova Scotia Duck-Tolling Retrievers, and soft-coated Wheaten Terriers. Addison's is primarily found in young female dogs, but it can affect any age and gender. How do dogs become diagnosed with Addison's disease? Addison's disease is relatively uncommon and has vague symptoms that can be mistaken for other diseases, such as kidney failure. It is usually diagnosed after a dog has an Addisonian crisis. An Addisonian crisis is when a dog suffers a life-threatening symptom after the disease reaches an acute stage. After the Addisonian crisis is treated and the dogs are diagnosed with Addison's disease, they are then closely monitored and typically put on steroids. In Laney's case, she has atypical Addison's, which means that her body produces aldosterone but not cortisol. She was diagnosed with Addison's after suffering a major seizure, which was her Addisonian crisis. Laney was started on steroids and has been able to maintain normal levels since. Thank you for watching. If you have any questions concerning your pet, please consult a veterinarian. If your dog has been recently diagnosed and you need more resources, check out these following sites.